Welcome back to Sports Massage Therapy Education. Today's video, we are going to be going over the bony landmarks and ligaments of the wrist and the elbow, and also looking at the structure of the joints themselves. So whether you're studying to become a sports massage therapist or you're just looking to brush up on your skills, stay tuned because I've got you covered in today's video. Okay, so before we can look at the bony landmarks, we need to understand how the actual arm itself moves. So we need to know what the joint actions are and the types of joints that we've got. So we've got a synovial hinge joint just here at the elbow, which is going to allow that flexion and that extension movement. But then what we have also got here is a pivot joint between the radius and the ulnar, which is going to allow for that pronation and that supination movement. So we're going to look at the bony landmarks now of the radius and the ulnar. So in order to determine which is which, if you get your client in the anatomical position, so with their palms facing towards you, thumbs out to the side, the radius is going to be the side that the thumb's on, and the opposite side is going to be where the ulnar is. So four of the key landmarks here is at the top here. So if you feel the radius and kind of follow it up, you're going to find the radial head. And then as we kind of go down, just before we reach those carpals, you've got the radial styloid process. Opposite to that is the ulnar styloid process. And then following it again all the way up, feeling until we feel that kind of bony landmark there, is going to be the olecranon process. So I want to talk you through the three key ligaments in the arm here. So these are what I would say are the three important ligaments that are going to work together because they help to stabilize any kind of unwanted movement. So what we're going to do is we're going to start with the ulnar collateral ligament. So what this does is attaches the humerus to the ulnar. So pretty much just over here on where the ulnar is here, it's going to attach up and come across just this particular area here, linking those two together. You're also going to have the annular ligament now. So what this is going to do is attach the radius to the ulnar, and this will actually run across just through here. And then a little bit further down now, we've got another one that links the radius and the ulnar together now. And this is what we call the interosseous membrane. And that is going to just come across just here, linking the two of those together. Sorry to interrupt today's video, guys, but did you know that 96% of you watching are not currently subscribed? If you could take just 2 seconds just to hit that subscribe button, it would mean the world to me. Thank you. Let's get back to the video. Okay, so we're going to focus on the wrist now, specifically going through the carpal. So if we follow the thumb down, what we're first going to come across is the trapezium, and just below that, we're going to have the scaphoid. Sitting ever so slightly above that now, we're going to have the trapezoid. And then what we want to find is just in the middle here, if we're kind of feeling around, you're going to feel what we call the capitate carpal. And then moving ever so slightly over to this right-hand side now, so towards the pinky, we're going to have the hamate. So the hamate is actually going to sit just at the top, and underneath that one, you've actually got two very close together. You've got what they call the pisiform, and you've also got the triquetrum as well. And then just following round, we're also going to have the lunate carpal. Okay, I want to talk to you a little bit now about carpal tunnel. So thinking in terms of those carpals now, obviously we've got the hand flipped over, but pretty much kind of central. What we're going to have here is the scaphoid and the capitate. And just behind those, we're going to have what we call the median nerve, which runs the whole way down.
So what exactly is carpal tunnel syndrome? Well, this happens when the median nerve in your wrist gets compressed. This nerve runs through a narrow space in your wrist called the carpal tunnel, along with tendons that move your fingers. If that tunnel gets tight from swelling, repetitive use, or bad wrist posture, the nerve gets pinched. That leads to tingling, numbness, and pain in your thumb, index, middle, and part of your ring finger. You might also notice weakness in your hand when falling asleep as well. It's also very common in people who type a lot for their job, maybe they use tools, or they have conditions like arthritis or diabetes. So treatment ranges from wrist splints and posture changes to injections or surgery in serious cases. As a sports massage therapist, our goal is to help alleviate some of those symptoms, but in most cases, we're not going to be able to actually cure the problem itself.
And that is a wrap on another video. So again, thank you all for stopping by. As always, don't forget to like, comment and subscribe. Let me know down in the comments what kind of videos you want to see next. And as always, I will see you in the next one.